ECG partner associated with left anterior descending coronary artery occlusion. Personal data. My name is Arler Bravo Montes and my teacher is Moscoso Escobar John Fernando. Definition. This sloppy ECG partner of ST segment depression that continues into tall symmetric T waves in the precordial less something referred to as the winter partner has been associated with occlusion of the proximal left anterior descending coronary artery. Continue the video.
What is LAD blockage of heart? LAD stands for left anterior descending artery. It is a coronary artery, which is the name given to arteries that supply the heart muscle with blood. It's called the LAD because it is on the left side of the heart, left, runs down the front wall of the heart, anterior descending.
Application in medicine. The patient underwent immediate coronary angiography and the procedure revealed 95% stenosis of the proximal left anterior descending coronary artery. The stenosis was treated successfully by means of percutaneous coronary intervention with stent placement. Continue the video. Pros and cons. Pros. The troponin 1 level rose to a peak of 7.19 ng per milliliter 14 hours after the procedure. A post-procedure ECG showed evolution of the ST segment and T-wave change with new T-wave inversion in length 1 AVL and V2 through V6. Cons. He was a current smoker with a smoking history of 10 years and electrocardiogram showed a sloping ST segment depression and tall symmetric T waves in length V2 through V5. Continue the video. Issue epic. There is not much information on the subject in Ecuador because the study was conducted in New England on April 19, 2018 by Yun Tao Shao and Yan Shu Huan. Continue the video. Conclusion. The patients began due the line directed medical therapy and was discharged home. He also recited a smoking cessation counseling and was referred to a cardiac rehabilitation program. Continue the video.
The most common symptoms that people think of when they talk about blockage in the heart is chest pain, and that is the majority of the cases. Having said that, there's times where people presented with what we call not typical symptoms. Diabetic, for instance, in females tend to present in non-typical symptoms more often. That could be just upset stomach, just overall not feeling well, dizziness. Sometimes the pain is in the back and the jaw and the shoulders. So it's not just the chest pain that could be a symptoms of blockages in the arteries. There's two ways to diagnose the blockages. There's what we call non-invasive tests, such as stress tests, EKGs, and so forth. Those are great initial screening tests. They're very non-invasive and safe. The problem, or the limitation I should say, is the sensitivity of those tests. It's about 85%, meaning there's 10-15% chance occasionally we can miss something on those tests. The ultimate diagnosis for blockages is with the heart catheterization, but this is a little bit more invasive test, so we reserve that to situation where the suspicion is really high, or if somebody had an abnormal stress test, and that test basically going inside the body with a small catheter and injecting contrast. This is a 100% test. There's either blockages or not. Doesn't have any false negative or false positive to it. Any blockages, it is concerning. What it's different is how you treat it. Mild blockages does not require intervention, meaning balloon or stent or surgery. The focus more is on controlling the risk factors such as high blood pressure, cholesterol, diabetes, smoking, and so forth. In more advanced phase, when the blockage is severe, meaning more than 80% or so, then this is when it's time to intervene on the blockage, whether it's with stents or surgery or whatever it's appropriate for the particular blockage. It becomes a technical issue.